Hey guys, how many of you know somebody who's went to a chiropractor and they said chiropractic just didn't work for me? And that situation and that comment always bugs me because there are very few people that we don't get better in here. So I want you to understand that in the field of chiropractic, there's a spectrum of chiropractors, and each patient has certain ways that they want to dig into chiropractic, and some are going to be on the low end of comprehensiveness and some are going to be on the high end of comprehensiveness, and that's what the patients want. But I just want you to understand that the approach in our profession, there's a huge spectrum of approaches to all types of conditions. So this is a really cool case. This guy was in a car accident 20 plus years ago where he had his abdomen tore up, lots of abdominal surgery, so it really affected his core. He has had chronic severe back pain for 6 years, no resolution, has had other conservative treatments, and these are his X-rays. So when he comes in, you can see that there's arthritic change right here, and you know, on the spectrum of chiropractic, we function on the far end of comprehensiveness. So this is my chiropractic continuum. So it's Dr. Nagel's, this is my opinion. And on the low end of comprehensiveness, which doesn't mean that it's dangerous or anything like that. I'm just, when you have big cases in or big problems, you know, on the low end of comprehensiveness, just kind of getting your back adjusted and, you know, get your back adjusted. All right, come back when you need me. That's a pain management model. So that would be like if you went to a dentist and they said, yep, you have a cavity, we'll fix that cavity. All right, you know, go ahead and be on your own. You don't have to come back. You don't have to brush your teeth. Just next time your tooth starts hurting, come in here and we'll fix it again. So that's the pain management model. Lots of that going on in chiropractic. We even have that in here, and I'm totally fine with it. I just want patients to know that we offer a more comprehensive model. So we have patients all through this spectrum. Their model of care that they choose is somewhere along here, but we always evaluate and create plans on the high end of comprehensiveness, and if they choose to do other, you know, that's up to them. So on the far end of comprehensiveness is looking at the spine from a structural and functional approach. And so I'm going to show you this. Structural, you have to take X-rays to see what's happening with the structure. And functional is core strength, glute strength, shoulder position, shoulder strength in the right spots. I'm not going to get too technical with you, but all of those things are really important so that the body works like it's supposed to. So we take X-rays. Sorry here, got a screensaver. Okay, so here's some X-rays. So this is from 6/24/19, and the reason I chose these is this patient got better, and then I saw him last week and he's still better, and so he's been out of corrective care for about 4 months. So when you have a comprehensive approach, it's, you know, you're always managing these chronic conditions. You don't cure them, but you know, the likelihood of it flaring back up and being debilitating is much less when you approach it from a comprehensive standpoint. So we have sophisticated software to analyze our X-rays. So we take these X-rays, and his head is off here. It's off about 1 inch, which adds quite a bit of weight, 20 some pounds of weight. And then when I look here, he has a major hypermobility. So this is probably due to being in that car accident, so he had trauma, plus he has inadequate core stability, especially on the one side where he had this abdominal trauma. So he went through a comprehensive functional movement and structural correction program for 3 months. He chose to do that because he wanted root cause. He wanted to get further upstream to fix this problem. And here are his afters. So this is his neck. So green is good, right? Red is where the patient is. So you can look at this across the board. Here he has hypermobility and a retrolisthesis. This is probably 40 years of degeneration, all right? This is nothing new. This is nothing new. But look what we did under corrective care. Totally reduced that. And brought his head back so he doesn't have so much tension under his skull, which is headaches, you know, neck pain. And then here's his low back. So when you look here, remember this big, it's called retro because it goes backwards. Retro means backwards. Look at that. So totally lined up right there. So definitely structural correction. So when we take this approach with structure and function, so when I talked about his core being torn up, every day he came in, we worked on the structure, and he also went in the back, and we did lots of core exercises specifically for his structural correction and his functional deficiencies. So, and here we are, like he's 4 months out of, graduating from his corrective care, and we see him, periodically to maintain his spine, just like you brush your teeth. It's spinal hygiene versus dental hygiene. Everybody gets that dental model. But, he's 4 months out and he's still doing great. So that's, real comprehensive resolution. So that's your health nibble for today. It's health nibble number 119 that, I can't remember the title of it, but basically not all chiropractic approaches are the same. So, comprehensive care is essential. And if there's somebody you know and you care about and they have a big problem and nobody can get them better, share this with them. We'd love to help them.